Bailey Owens is a 38-year-old female seen today via telehealth. She complains of sudden onset mid back pain that happened 4 weeks ago while on the treadmill doing overhead presses with dumbbells. The pain has been constant and it is worse with activity. It's stinging and burning in nature. It's a 4 to 5 out of 10 of pain at rest and 9 to 10 with movement. Her range of motion are intact as demonstrated on the telehealth video and testified to, but the movements increase her pain. She's tried heat, ice, biofreeze, and ibuprofen 800 milligrams Q6 hours with minimal relief. The pain makes it hard to get to sleep and wakes her up at night. There is no radiation of the pain, and the pain is not dependent on the time of day. It is not tender to palpation per the patient. I had her palpate her own back in our telehealth visit, and she said that it was not painful. This differs slightly from some of the reports of the physical findings given to us by Dr. Finnegar. The patient drinks 4 to 5 drinks 3 times per week, does not use any tobacco or drug use. She has a desk job but is very active outside of that, running and lifting weights, and reports a healthy diet. She has been diagnosed with depression and acid reflux and has had various strains and sprains due to sports over the years, but never had anything this bad. She's never had any surgeries. She's allergic to latex, which causes a rash and swelling reaction. Her father had prostate cancer and hyperlipidemia. Her mother has rheumatoid arthritis. Her sister has asthma, and her brother is in good health. Bailey denies fever, chills, recent illness, fatigue, malaise, denies incontinence or any change to bowel and bladder habits since her injury. She denies shortness of breath, chest pain, cough, palpitations. Also denies headache, dizziness, numbness, tingling, sensation changes, or any changes to her gait or balance. She does endorse mid-back pain, reports full range of motion, but range of motion movements increase her pain. She denies any other joint pain or a limited range of motion with any other parts of her body. Per Dr. Finnegar, heart rate is 72, blood pressure 125/58, respiratory rate 18, oxygen sat at 100%, and temperature 36. Tenderness elicited mid-spine T6 through 10 with no paraspinal muscle spasm. This is somewhat different than what I elicited during the patient interview and telehealth and when I had her palpate. Also says range of motion of spine with normal extension, limited hip flexion, and excessive lumbar flexion. Patient has difficulty sitting in upright position with good posture. This is also different than what was demonstrated and talked about during my telehealth visit with her. I did not find out the patient's medications, supplements, or vitamins. I also did not ask if she heard any crack or pop when the injury happened. I wish that I would have asked those things, and I will ask them next time. My Vindicate list was quite extensive. I have no reason to believe that this is a vascular or infection cause. Due to the fact that I didn't get her medication list, I cannot completely rule out drugs as a cause. There are certainly some degenerative changes that could be happening. No reason to believe that there is a neoplasm, but congenital, autoimmune, and definitely trauma is at the top of my list here. So I've narrowed it down into 3 differentials. I have a muscle strain, vertebral compression fracture, and herniated discs as possibilities. The most likely diagnosis is muscle strain, followed by vertebral compression fracture, and then herniated disc. The patient is young and reportedly healthy. She's active. The injury happened while doing overhead presses on the treadmill. This is consistent with muscle strain. Her pain is lessened with rest, worse with range of motion activities, but her range of motion is not impaired as testified to by the patient and demonstrated on telehealth. Additionally, she, in the physical exam finding from Dr. Finnegar, said that she does have tenderness to that specific area, which also lines up with muscle strain. Next on the list, also likely, but not quite as likely as the muscle strain, is a vertebral compression fracture. I would like to get some more information from the patient about this. I have no reason to believe that a neoplasm could have caused a compression fracture, um, but there are some other causes, including osteoporosis. Um, Notably, Bailey has tenderness to palpation, T6 through T10, and compression fractures most often happen in the thoracic spine. Physical exam findings from Dr. Finnegar say that she has difficult sitting up straight. If she has multiple compression fractures, this could cause kyphosis or extreme pain, causing her to not want to sit up straight. However, the patient did not display that on the telehealth visit that I had with them. The patient is young, reports physical activity and a healthy diet. These are all protective against osteoporosis. And though she is female and has substantial alcohol intake, and those are risk factors, she does have some protective factors. She doesn't have any constitutional findings that would make me make me suspicious for neoplasm. Unfortunately, I didn't gather information related to her height, weight, BMI, medications. So I don't know if she's ever had a history of anorexia nervosa, if she was on long-term steroids, any PPIs, what her stature is. Those could have significant increased risk for a pathological compression fracture. Herniated disc is possible, but relatively unlikely. It could be the cause of her pain related to the strenuous activity causing a herniated disc, but other features of herniated disc are not present. She doesn't have any radiation of her pain, nor does she have any numbness or weakness. So my plan for Bailey is, in order to treat her muscle strain, she is taking 800 milligrams every 6 hours of ibuprofen. Tylenol is not going to help her a whole lot, so she can continue to take the ibuprofen if she wants to try 500 milligrams 3 times a day in between the ibuprofen and see if that helps her. She would be welcome to do that, as well as ice and heat as needed. I would like to refer her to physical therapy so that she can get some appropriate stretching techniques down and help with her healing process. Being that her pain is still significant with the ibuprofen, and she said that heat and ice did not help very much to begin with, I would like to add a cyclobenzaprine as a muscle relaxant to aid in her comfort while she heals. The fact that this has been going on for 4 weeks is concerning, so I would like to also get a radiograph of her back to ensure that there are not any compression fractures. However, it can take up to 7 weeks to see improvement in a muscle strain injury pain. So I would like her to get the x-ray. In the meantime, I will call her with results, and she should follow up with me in 2 to 3 weeks in the office. At that time, I would like to recheck her blood pressure, as it was just barely elevated. That could be due to the pain that she's experiencing. I would also like to screen her for alcohol misuse or abuse, and counsel her in reducing her alcohol intake. At that time, I would also like to confirm her medication names, supplements, and vitamins, and see if she is satisfied with the control of her acid reflux and depression at this time, as well as recheck on the back pain. And that is my plan for Bailey.